In order to be considered a continuing care retirement community, or a CCRC, a community must offer assisted living, nursing home care, and independent living all on one campus. An older adult must move into a CCRC whenever they are healthy. Although the settings will be different, most have a common dining room, gym, swimming pool, activity centers, and outdoor recreation. There are special events that happen on the campus, and oftentimes there will be outings to events like going to a symphony. Depending on the community, the living spaces may include cottages, clusters, houses, duplexes, apartments, and townhomes. Choosing to live in a CCRC can be pretty expensive, and those who have low or even middle-class incomes and assets normally aren't able to afford this housing option. The payment plans vary in each CCRC, but there's normally a large entrance fee that is required. They can range between $10,000 and $500,000. At most continuing care retirement communities, the person isn't purchasing the place that they live in, so the resident must pay a monthly maintenance fee, which may range from $200 to $2,000. A contract between the resident and the CCRC will state what the monthly maintenance fee covers, as well as the costs and coverage of healthcare. The health and wellness centers will lead the senior living activities in order to help all seniors be able to lead a more active life, which can be quite hard to coordinate in a regular community. This community-centered, engaging lifestyle is what will help to keep residents healthy. Outside of the CCRC, the elderly may need someone to mow their lawns and even take them to the grocery store. They may not even want to prepare their own meals. This community awareness of an individual will also help with any healthcare needs. Maybe a resident always keeps their apartment spick and span, but now it is a lot more messier. The staff will also help to ease the transition into the other levels of care. Knowing the most care except for hospitalization is provided on the campus can certainly be a reassuring thing for any resident. Although a CCRC isn't always the best thing for all people, a person that is moving into a community that is made up of mostly senior citizens often enjoy the intergenerational mix of this neighborhood because there are young couples, toddlers, and even retirees. A person needs to be comfortable with both the monetary responsibility and healthcare continuum of living in a CCRC. Making the choice for healthcare options for the rest of a person's life and committing to a financial obligation for the rest of their life is a pretty big choice. When a person makes the commitment to live in a CCRC, they will sign a continuing care agreement. A financial advisor or lawyer should review this document first, as it is a legal contract between the CCRC and the resident. According to the AARP, the contract should cover the following items: residences, healthcare coverage, services, fee schedules, insurance requirements, cancellations and refunds, conditions for transfer within the community to the other levels of care, as well as a description of the CCRC's responsibility should a resident ever become unable to pay their fees. Every contract should have a refundability clause. If a person decides to leave the continuing care retirement community, they may lose part or all of their entrance fee, depending on how long they have lived at the CCRC. Most of those who are in a continuing care retirement community offer multiple agreement choices, and the residents are able to choose based on the degree of refundability. There are normally 3 types of fee schedule options at most CCRCs. Extensive contracts. These tend to be the most expensive agreements, as they give residents unlimited access to healthcare with little to no increase in a monthly maintenance fee. Modified contracts. These types of contracts tend to offer residents unlimited access to healthcare, but the residents may pay for healthcare as needed, with a monthly maintenance fee that increases to cover any healthcare needs. Oftentimes, the healthcare costs are offered at a discounted rate. Fee-for-service contracts. These are the types of contracts where the resident will pay for all of their healthcare costs separately. However, this can be initially the least expensive contract. It can become quite expensive. The resident eventually needs to have any type of extensive healthcare. CCRCs may even offer residents a certain number of skilled care days each month without having to raise the monthly maintenance fee. There are times where this is part of the modified contract schedule option. Beyond the continuing care agreement, any potential residents will need to explore the details of each CCRC that they are considering fully. Normally, CCRCs were not-for-profit organizations, but today there are some CCRCs that have a for-profit type of business structure. If the CCRC happens to be for profit, then the business may be sold at some point. If there is a possibility of sale, how would this affect the contract of a resident? There are some CCRCs that are accredited by the CARF-CCAC, a very lengthy process that has to be renewed every 5 years. If a CCRC is approved, then there is an annual and continuous reporting process during this term. When visiting a continuing care retirement community, try to keep the following important questions in mind. Does the CCRC have a resident agreement with any nearby communities? What happens when the assisted living and nursing home facilities are full? What is the staff-to-patient ratio for each living setting? How well is the staff trained, and do they go through criminal background checks? Is there memory impairment services or Alzheimer's unit? Does the CCRC appear to be clean, well-maintained, and safe? How is a resident able to participate in any of the organization's decision-making? Is there a special role for those who want to become involved? Does the CCRC culture match the resident? Is it a more formal environment, where dinner jackets are required in the dining room, or is it a more casual atmosphere? Take time and explore the full range of wellness and health activities and social events both on and off campus. Don't just look at the independent living quarters. Be sure to visit the assisted living and nursing home facilities as well.